See, what we do is we take a CT of the patient's entire leg, starting from the hip up to the foot. With this technology, we bring in the model of the analysis of the knee, perform the exact angles, actually perform a virtual operation in the computer itself. We do the cuts. Actually, we can actually see the cuts being made. We take a measurement of how much the cuts have to be. We actually pre-plan this operation, and this actually makes the operation so much more simple. What used to take 1 hour in the operating room is now finished in 15 minutes because you have actually planned the operation earlier. These jigs are then manufactured, which is what is called a 3D printing technology. The jigs are manufactured, and for a patient, for the individual patient, a patient has an individual jig, and which is disposed and thrown off after the operation. So these jigs are actually placed on the bone when we open the knee, and then these cuts are performed. And this is actually replicating what we have actually done in our planning sessions. So we have an absolute control of what we remove, how we cut, everything is actually pre-planned.